WCLN 1170 Radio and Cable Channel 16 are pleased to present We Should Know, hosted by J.W. Simmons, an upbeat, informative look at people, places, and issues facing our community. This education-based analysis of issues will remain positive and informative as we consider closely what we should know.
Back, We Should Know is on the air. I want to thank you for being with us today. Each and every week at Tuesday, we come to you from Star Communications Channel 16 to WCLN Radio. Also want to remind you that if you have any questions, you can email us at weshouldknowedu@gmail.com. Over the past few months, I guess you have discovered we've been in a pandemic. Been a lot of issues that you have faced, challenges you have faced, and a lot of those builds itself around behavioral health. Today we have with us Christy Hawley. Christy, you are a licensed clinical mental health counselor. You have supervised, you're director of behavioral health for Commwell Health. Multiple backgrounds in everything from teaching to counseling. I want to thank you for being with us today.
So thank you for allowing me to be here today, inviting me, and just having the opportunity to talk about mental health and what we do within mental health.
Why mental health? How did you get into counseling?
Counseling honestly just found me. I've always just kind of had a laid-back nature. When I started college, I really didn't know what I was going to do, and I took one psychology class, and from that moment, I was really hooked on psychology. It was just so interesting to learn about the way that we think, our behaviors. It was just very intriguing. And so I continued on with psychology, and later on just found counseling, just kind of landed there.
And I noticed you have a bachelor's degree, a master's degree. You've also done doctoral work in the field of psychology and counseling. The depth that you've chosen to take this tells me you have a lot to say about a lot of things. Is there some specific things that you have encountered during the pandemic that typically has surprised you, or has it certain things with people's behavior? Have you seen some intense awareness on your part as a counselor as you've talked to folks? I've
certainly seen a lot of people really struggling with the stress that has come along with this pandemic, and really just having to adjust to a new way of life. I've seen some hardships that people have experienced, whether it's losing a family member or a friend to COVID, having to readjust to children no longer being in school, and help them adjust to virtual learning. But I've also seen some strengths in people and resilience to really overcome some of the struggles and challenges that we've all faced, during the pandemic.
There seems to be an increased concern, and statistically some of the numbers would indicate an increase in certain abuse of substances, everything from alcohol to controlled substances and those kinds of things. Have you, in your position in the oversight with Commwell Health, do you see a lot of that in the rural areas as well as in the urban areas? Absolutely.
And so over the past year, there's been a lot of research that shows that there has just been an increase in depression, people who are reporting depressive symptoms, so depression, anxiety, suicide rates have gone up, as well as substance use. Individuals, using more alcohol, using more substances during this time, just as the stress of dealing with the pandemic. And that's certainly something that we have seen at Commwell, just an increase in patients coming in who are really opening up about how they're being impacted by the pandemic.
I think one of the things that strikes me as I read and I see a lot of stuff in media format is there's a need for folks to feel like they have a way to reach out to someone. Yet there still seems to be a stigma in our society that it's easy to go get a toothache fixed if you go to the dentist, or if you have sprained your knee or your ankle, you go to your medical doctor. But there seems to be a hesitancy with some folks to reach out to a person like you that's a counselor, that has clinical credentials, or even to a psychiatrist. Why do you think that is?
Absolutely, and that is something that we certainly see in mental health, that there is that stigma. And with like a medical problem, I think sometimes it's a lot easier for someone to say, here's this cut, here's this wound that I have, let me go to the doctor, and they can physically make those repairs, suture it up, it heals up and you can see it. But with mental health, some of those struggles, some of that pain, trauma is internal, something that we experience, and it's not always something that people visibly see on the outside. And so because of that, people sometimes have a hard time reaching out for help because other people can't see, the wound or, what they're struggling with. And so we've been taught, to just suck it up, deal with things, that, we don't want to show any type of weakness, that this is the way that life is. It's not perfect all the time, that there are going to be hardships. And so we take a lot of pride in that, in being able to be self-sufficient, take care of ourselves. And people are sometimes just hesitant to ask for help. Whereas if it's a medical condition, a medical issue, people tend to be more at ease about seeking help.
We as a society, I think we're very strong. We're people that have a great amount of determination. Oftentimes I hear folks say one of the problems may be that folks feel ashamed of saying, that I visited my counselor today, versus saying I went to my medical doctor. It's okay, but if you go to a behavioral health counselor, they see that as a sense of weakness. Is that something that has happened over time, and how do we remove that stigma?
By removing the stigma, people just really, I think, talking about their experience and saying, hey, I have a counselor, or I've had to go and ask for help. I know, certainly working with clients, that is something that I have shared, with clients that, I've reached out and had to have help, and just normalizing that it is okay and it's not a sign of weakness. And especially over the past year with the pandemic, if someone hasn't been impacted by it, to me, that's more of a problem than, someone having some sort of mental health impact, over the past year, because we've all been impacted by this. And so, just knowing that it is okay to seek help, it's not, a sign of weakness, and that, we are taking our own health and making it a priority, and knowing that we don't always know all the answers or what to do with how we're feeling or the experiences that we've had, and that we can seek guidance, on how to cope.
When I look at this, and I guess we could call this a sense of self-denial as it relates to not seeking help, does that come from generations and generations of kind of not having the availability of behavioral help? Does it help us to understand more about what you do and what Commwell Health offers that can help us get out of that denying that we might need some support behaviorally?
I mean, I think that, that is something, just the mindset that, we take care of ourselves, we're self-sufficient, that we're strong mentally, and that we are going to experience hardships, and we just deal with it on our own. That is, some generational thinking, like I said, that we really take pride in. And especially in like rural communities where resources have been really limited historically, and ongoing, to where People may have to drive into more urban areas to seek out assistance. And so in rural communities, and at Commwell Health, we do serve, many rural communities. That is something that we, it's important for us to provide those services where resources just may be limited. And so people in rural communities just know, like, we've got to take care of ourselves and take pride in that.
It's interesting when I see the logo for Commwell Health, I see not only medical, but I see the dentistry bus at schools at times, and they're really concentrated in a lot of the rural areas. But oftentimes I don't necessarily tie that to behavioral health. Is there an effort to try to fly that flag, if you will, of behavioral health, that here we are, or do you kind of keep that somewhat low key? How do you get that message out that you are a structural part of Commwell Health?
So we have been doing a lot of community outreach with COVID and providing COVID testing as well as vaccines. And so a lot more people were learning about Commwell Health and all the services that we provide. And so you mentioned a few of the services, including behavioral health. And so just to tell you a little bit about Commwell Health. So back in 1976, Commwell Health started out as Tri-County Community Health Council, and it started as a health center to provide medical services for farm workers in the area.
We're going to talk a bit about that when we come back from break. Ladies and gentlemen, we're going to take a quick break. We'll be back in a moment. We're talking with Christy Hawley with Commwell Health. She's in charge of behavioral health for the entire operation there. I certainly hope you call a friend and stay tuned. We're going to get into details on this subject when we come back. Stay tuned.
Experiencing slow internet? If you have a fast internet package, the problem is most likely your wireless router. With more devices using Wi-Fi, your wireless router may not be able to deliver the speed and coverage you need. We now have the leading solution to enhance your internet experience. Using small devices in a mesh network, these Wi-Fi appliances cover just about any size home so that all your devices can operate to their fullest potential. Whole home Wi-Fi from Star Communications. Get the most out of your internet connection.
Ladies and gentlemen, welcome back. We're talking with Christy Hawley, Commwell Health, Director of Behavioral Health for Commwell Health. Christy, as we went to break, you were talking about the Commwell Health and some of the kinds of services and the things that Commwell Health does. Big picture of Commwell Health is a total health organization, and that's every kind of thing as it relates to physical health, but also a huge area that you are in charge of, director of, is the behavioral health area. Go ahead and explain the history a bit of folks, because they might see that Commwell Health logo somewhere and not really understand what an organization it is and the kind of, should I say, firepower you got, the kinds of capacity you have. So I'll let you talk about that a bit.
Okay. So, I grew up in Sampson County. Mm-hmm. And prior to working at Commwell Health, I didn't know, about Commwell Health and the services that we provide. For many years, Commwell Health was previously known as Tri-County Community Health, and it started, as a health center for farm workers in the area, and just has continued to just really grow and develop. And so back in 2012, we rebranded to Commwell Health to really reflect one, that we were growing and no longer just providing services in that Tri-County, so Sampson, Johnston, and Harnett counties, but we had expanded, and now we are throughout southeastern North Carolina. And so we rebranded to reflect your community, your wellness, and your health, to show that we are providing those person-centered services, and not just medical services, but we do provide medical services, dental, and the behavioral health. and the behavioral health services that we do provide. So we provide outpatient therapy, which includes a psychiatrist, providing medication management, outpatient therapy with counselors. We have a crisis walk-in center in Clinton, known as Building Bridges. And some other things that people may not know is that we also have 2 residential programs for individuals struggling with substance use. And so we do have a men's residential service that we provide at the Harvest House. And so it is a 30 to 45 day treatment program. And for women, we have the Angelic House, which is a residential treatment for women specifically for substance use disorders. And that's about a 3 to 4 month program.
Do you see a lot of folks that are aware that you do have that walk-in clinic? And I believe it's located on Beeman Street here in Clinton,
Yes.
correct?
A lot of people are familiar with Building Bridges and are aware that we do provide the crisis walk-in services, so which is just a great place to go if you've never been involved in counseling, not quite sure, but think that that you're experiencing some depression, just not feeling so good, just really stressed out. That we do have clinicians there during our hours of operation who can do assessment and triage. Looking to see if there's any safety concerns, and then provide recommendations for what the next steps would be.
I guess when I look at behavioral health, I think in terms of a lot of things that I see people do that are rather bizarre. And of course we see a lot of those on the nightly news and the morning news where somebody's done something completely out of character, and we refer to it oftentimes as behavioral health. Help us kind of understand what we're seeing, because it's one of those worlds that I guess has some parameters, but how do you define for folks that, for example, you have a behavioral health problem or you need some counseling? How do you help folks understand that what they're doing is not within the norm of what normal is? And of course, I ask that question knowing that we've lived in an abnormal world here for the past few months, but how do you do that?
So I really think that it comes down to the person, and looking at how is this behavior, how is this impacting you or your ability to function? Is it that you're having a hard time carrying on with just your normal duties, with relationships? Is this a problem for you within your community, at your school? And that it can really come down to the person and really assessing and working with the individual to help them understand, how is this impacting my life? And if it is problematic, then it's certainly something to consider pursuing, in counseling, working with a clinician, a professional, to figure out ways not only to identify the problems, but ways to cope, with the problem.
Just let's do, if you can, kind of give us a walkthrough. Somebody feels, he was watching this show, they hear you and they say, well, I feel like I maybe need to reach out and just have a conversation. They pick the phone up and they call Commwell Health. Obviously, you said there's a triage kind of thing. How is it determined as to the immediacy of the need of that person calling? Now, we know in physical health, if the phone rings, oftentimes if it's, quote, critical, the person will dial 911. They send a truck out with people on it called paramedics. They pick them up. But can you not find people oftentimes that call in that also needs that same 911 response? And is it there for people that are in critical need for behavioral health? I guess to context that question, if a person's in critical need, can they get that same kind of quick response from Commwell Health?
Absolutely. And so as I was saying, at Building Bridges at our crisis center, so someone doesn't necessarily have to have an appointment to be seen by a clinician. They can just call in and set up that appointment for a triage. And the purpose of that triage, that appointment, is really to assess safety concerns. So we really want to look at, is that person in imminent, do they have an imminent risk to hurt themselves, to hurt others? And if so, then immediate action, needs to take place, and we can pursue other steps to make sure that they get the treatment that they need at a higher level of care. For instance, like going to the emergency room. In an outpatient setting, so someone coming in for a scheduled appointment, on their first appointment, what we do is we do just a full evaluation, which sounds a little intimidating, but really it's just sitting down with the clinician, kind of like we are today, and just looking at someone's previous mental health history, family history, medical history, looking to see if they're having problems in just daily function, so eating, sleeping, how are they feeling, really to get a good idea as far as their history, what they're currently struggling with, and then they would work with the clinician at that first appointment to develop a treatment plan for the individual to identify, these are the goals that I would like to set. These are the things that I would like to work on to improve my overall mental health.
So it sounds like what I'm hearing you say is folks need to establish in their mind a picture that the response to behavioral health is different than the response to physical health, in the sense that it's not as immediate. That, for example, when they need behavioral health, they can come in or they can call, but the process is going to take a bit more time than if you went, for example, to the emergency room and you had broken your finger. They're going to reset the finger, and there's a methodology in that. But with the behavioral health, it's a different kind of pathway to try to figure out exactly what that problematic area is. Mm-hmm. And kind of help us understand that a little bit.
So, and we do identify routine needs as well as urgent and emergent needs. And so during that triage process for crisis walk-ins like that, that's something that we look at. Is this an emergent need, which is, the person would be, bleeding out, if we were thinking, in medical terms, mm-hmm. that they needed immediate assistance right then. They were really at risk to, hurt themselves, and that would require an emergent response where we could assist them in getting to the emergency room in a safe environment, to make sure that they're protected, and then get them the treatment that they need. An urgent appointment or request will be, someone who needs, they are in the midst of a crisis situation, but not an emergent situation, where they do need to get to a counselor or professional pretty quickly. And so we identify those patients as an urgent need. And then our routine appointments, which is, maybe it is a parent who is trying to set up services for their teenager who's struggling in school, who is having a hard time sleeping, and so there's not an emergent need. It's not an immediate crisis, and that would be considered a routine type appointment where we could schedule them to come in and meet with one of the clinicians.
And I think as you were talking, I'm tying that word emergent with emergency or critical mm-hmm. immediacy of the need, of the specific of the need. So we're going to take a break. When we come back, I want to kind of get a little bit deeper in that response and kind of give folks an idea of what actually goes on. So we'll take a break and we'll continue that. Ladies and gentlemen, I want you to know we're talking about behavioral health, a subject that oftentimes people turn away from. Fortunately, we have somebody with us today that can tell you what to expect, some of the things you need to look for, not only in yourself, but those folks around you.
At home or away, knowing who is at your door is priceless. Star Communications is here to help with its doorbell security camera by Skybell. Live viewing and two-way audio equips you with the ability to always see and greet anyone that shows up at your door. If this is the kind of confidence you are looking for, call Star Communications today at 1-800-706-6538 to learn more about this intelligent security that you can always depend on.
Ladies and gentlemen, welcome back. Thank you for being with us today. We're talking with Christy Hawley. The name of the show is We Should Know. I'm J.W. Simmons, your host. We're talking about behavioral health. Christy, there's so many different things that we've talked about as it relates to behavioral health in the first couple of segments. As we open this third segment up today, talking about behavioral health, we went off air talking a bit about kind of preparing yourself for that journey. We talked about the symptomatic issues that people sometimes confront. I want to get in a bit into now the part where someone realizes maybe I do need to talk to someone. Maybe I need to pick up the phone and call someone. Maybe I need to use the walk-in clinic that's available to them here in Clinton on Beeman Street. Walk us through that. The person walks in that door. They've been having problems sleeping. I'm just using one of thousands of examples. Maybe they've had too much alcohol for that 1 week. Maybe they've noticed that they're dependent on a substance. And they walk in the door, well, I need to see someone, I've been having problems. Tell us kind of what they should expect and what's the feedback in that process. What should they expect to give out? What should they expect to see and hear? And what does that environment look like?
All right, so one is that everyone's situation is truly different. I've been doing this for a long time, and I've not really ever had the exact same issue, multiple times. That, we're all unique and we all have different experiences, and so everyone's need is truly unique. And I do like to compare or use medical analogies with mental health, just to help us, understand a little bit more. And just like in the medical field, so there's different levels of care, such as the emergency room, ICU, and it's based on a level of need. What is needed in that moment, and it's based on the individual. So behavioral health is really set up in a similar fashion, to where whenever someone comes in, they would meet with a clinician and, just get some general information, how are they sleeping, eating, medications, really looking at safety concerns. Has someone been having any thoughts about wanting to hurt themselves or others, which does, if someone has been having those thoughts or having a plan to do those things, that really puts them in a more crisis level. And so during that time with the clinician, it would be determined what is the recommendation. If someone maybe is misusing alcohol or other substances, but they're still able to maybe go to work, and there's just a mild impact of that, then we could recommend, for instance, outpatient therapy with a counselor, or we could recommend, we have a program called Substance Abuse Intensive Outpatient Program, and it's a group specifically for individuals struggling with substance use, and it's offered like 3 times a week. For 3 months. It's a structured program that they graduate from, so that could be a recommendation. Say that it is, a teenager who's just really struggling to adjust to virtual learning. Maybe they're not able to sleep, their appetite has gone down, they don't have any thoughts about wanting to hurt themselves, but maybe just some thoughts that, maybe they're worthless or just feeling helpless. then we would recommend outpatient therapy, where they meet, with the counselor, really provide that the information for the initial assessment, evaluation, to really identify what the needs are, and then develop the treatment plan so that the teenager as well as the family have the opportunity to identify problems and develop coping skills on how to work toward the problem areas that they've identified.
And one of the things that you mentioned that struck me is that as parents, we typically think that we know what's best for our children. We can make the right decisions, and sometimes we get, I guess, maybe if a child's acting out versus being a child that's endangering themselves or others and those kinds of things. It's such a gray area for us. Is that when we need to turn to services that you guys offer to help us understand, is this something that's more serious than what we think it is? And of course, we're always going to think that nothing is very serious if it's our children, because, our children's never going to do anything that would be like that. So how and what is those things that should cause us to say, wait a minute, I remember seeing this show and this lady by the name of Christy Hawley, maybe this is the time that I need to call, or I need to discuss the behavioral of one of my children.
Honestly, I would say, if you're already having those thoughts of maybe I should or I shouldn't, that's usually a really good indicator of it is time to reach out. Ideally, in behavioral health, we really want to reach someone before problems escalate and it becomes that emergent situation. We really want to begin working on coping with maybe some minimal stresses, problems, symptoms, early on instead of waiting. And so, with parents, and working with parents, I always tell them, there's no manual for your kids.
Right.
Every kid is different. It doesn't matter if it's your first kid or your third kid. They can have different personalities and respond to the world differently because they're two different individuals. And so it's really just based on that particular child functioning. As I said earlier, a good time to reach out is if there's any problem in functioning. So if someone can't do something, can't take a shower, can't really eat, don't have the best appetite, maybe they're struggling to stay motivated to do their schoolwork, they're isolating from their family, then that is a good time, just to reach out and seek behavioral health services for the child, for the teenager, and also for the parent, because parents don't have all the answers. And it's okay for parents to say, I have no clue what to do. And that's actually, common for parents to share, once they get into the counseling sessions, to say, I really don't know what to do. And that is the purpose of behavioral health services. One portion is to say, okay, what is working, what isn't working? Let's try some alternatives to see if this improves the overall functioning, the situation with the child or teenager.
While you got your clinical psychology hat on, do we tend to parent as we were parented and pass those things down to our children, both good and bad? Absolutely.
I can't tell you how many times sometimes I think, oh my gosh, I sound just like my mother. Is that, we learn how to be parents from our parents. They are role models, even as we are children parenting us. And what we learn early on, we tend to implement the same strategies with our own children. And like you said, there's some certainly some strengths to that, and then there's also just some areas for improvements. One example would be, as we talked about earlier, just taking pride in being able to be self-sufficient, just kind of pulling herself up by the bootstraps, moving on. Sometimes with parents, it can be easy to dismiss the way that a kid is feeling. Say they didn't get invited to a friend's house. It's easy to say, well, that's okay. That's not a big deal. Mm-hmm. You just kind of get over it, which a lot of times that's how our parents just raised us. But in that moment, it's really important to validate, to say, what, that is really hard. This must be a really difficult experience. To really validate how they're feeling, acknowledge that, and then work with them on developing how do they cope with that, that disappointment, that hurt, in a way that's healthy.
I don't know, and you may be able to answer this question, but I don't recall a manual anywhere that anybody or any kind of training that was required that I go through to rear children. And I've always found that fascinating. We required certain things for you to do in society. There's certain courses you have to have a truck driver's license and all this kind of thing. But absolutely nothing to be a parent. Yet there's nothing more important in a person's life than parenting, if you think about it. What are we missing there?
Yes, and there's definitely no manual. There's no guide for any of us. And for parents, as I was saying earlier, each child can be totally different. You could take a training course on, okay, well, this is how I parent this kid. Then you have, the third kid, and they're totally different, and their needs are different. It is important for, parents to recognize the differences in their children, and just a good way to seek out guidance in dealing with some of those parenting challenges.
We're going to take another break and we'll come right back. Ladies and gentlemen, we're taking a break. We'll be back in a moment. We're talking about multiple issues with behavioral health. And certainly there's a lot of pathways we can go with this show. We're coming up on the last segment. Stay tuned. We'll be back in one moment to kind of help clarify some things and get into some more critical areas.
To get the most out of your electronic devices, you need a strong internet connection and a protected home Wi-Fi network. You need high-speed internet from Star. Star has the fastest, most affordable high-speed internet service available for all your devices. We have no long-term contracts or high-pressure sales. Our service speaks for itself, and switching is hassle-free. We take care of everything with free installation from a local company. High-speed internet from Star. Internet at the speed of life.
Welcome back. I want to thank you for being with us. We're coming up on the last segment today. I want to remind you the name of the show is We Should Know. I'm your host, J.W. Simmons. It comes to you each and every week, Tuesday at 2:30. Every week with replays at 7 p.m. Tuesday, Thursday on Star Communications Channel 16. Also simulcast on Tuesday with WCLN Radio. Yes, we reach about 8 or 10 counties immediately as far as our communication process is concerned. It's always uploaded to YouTube, various social media platforms following the show's original presentation. We've been talking today about behavioral health. A lot of the questions that you have, we know we're not going to answer today. We may have stimulated a lot of questions that you do have. We're going to be posting a telephone number. You can reach out to ask for assistance or if you need additional information. So take a look at the show and you can be glad to write those numbers down. If you have a suggestion for this show, please send us your email to weshouldknowedu@gmail.com. That's weshouldknowedu@gmail.com. And I appreciate your commentary, your suggestions for shows. Sometimes your frustration with shows, we take it all and we try to correct and move forward as best we can. But today's show, as we come on our last segment, we're talking with Christy Hawley again. And Christy, we've kind of given a bit of background on you and your credentials in the area to include a Bachelor of Science degree in psychology, a Master's in community counseling. You went to Commwell University and you're working on your doctoral program there. You have some doctoral work going on there. You clearly have a broad background in the field and specialty of behavioral health. as we start the conversation for this last segment, I just kind of want to make it clear to everyone that in the world of behavioral health, it's just clear that there's not a immediate specific fix. It's a process. Does that make sense?
Mm-hmm, absolutely. And you know, as we discussed before, that it really just varies from person to person. You know, and even sometimes with medical conditions and chronic medical conditions, there's no easy fix. You know, if someone's diagnosed with diabetes, yes, they can, you know, be required to take insulin, but it's ongoing. You know, they've got to work on changes to their diet. You know, they're encouraged to exercise. That there's not an immediate fix sometimes in the medical side either. And same thing, you know, with mental health, is that there's not an easy fix, and that it will require some changes, you know, whether it's within the family structure, on the individual level, you know, just like with chronic medical conditions, in mental health, some of the most important areas to start with is making sure that someone gets adequate sleep, that they're eating healthy, that they're exercising, that they're taking care of their physical body, because we are connected, you know, mind, body, and soul. We truly are connected, and taking care of ourselves physically has a huge impact on our overall mental health. And so, like you said, there's not just one direct path to wellness, and it does take time, and it can be a process.
Christy, does the statistics show that over this pandemic era that we've gone through, have we started seeing an uptick in suicide rates?
Absolutely, and unfortunately, there has been an increase in individuals dying by suicide. And so, you know, with this pandemic, people are facing financial loss, loss of families, you know, whether it's due to COVID, just experiencing just a huge negative impact, a lot of changes that we're having to make, just a lot of difficult situations, which historically, you know, the more stressors that we have, the more stress within our community, unfortunately, you know, can lead to those increases in deaths by suicide, just with compounding and accumulating stressors. And people just feeling, you know, that this is a hopeless and helpless situation, because it's had such a huge and profound impact on just our daily lives.
Is there something that people look at that are in the world that you work in when they're doing an evaluation as it relates to suicide? Oftentimes I hear folks to say, well, you know, this happened in my family years ago. Is there a genetic kind of thing that goes on with suicide, or is that a misnomer? Or?
So that's a really good question. So what we do look at are risks that could heighten, you know, the chances of suicide, and we also looked at protective factors too. So some of those risks could be a family history, and maybe there is like a genetic component to major depressive disorder or some other type of mental health disorder that you know, may have contributed to someone dying by suicide within the family structure. So there's, you know, that piece. We look at, has an individual ever made a previous attempt before? Have they ever been hospitalized for a similar incident? Are they harming themselves? So not necessarily with the intent to die, but, you know, maybe like cutting themselves, injuring themselves. We also look at like previous mental health history, things like that could, you know, heighten the risk of suicide. You know, do they have access to weapons? Do they have a plan in place? Or is this just something that, you know, they've kind of been thinking about, like, you know, I just wish I wasn't here, is different than, you know, yeah, I've been thinking about it. Matter of fact, I've been giving away some of my personal belongings, almost making preparations to end their life. So those would be risks that can heighten the potential for someone, following through with suicide. But there's also the protective factors, which includes looking at someone's support system. Do they have a good support? Do they have family who's supportive? Do they have someone that they can trust and talk to, which is really important for teenagers. Do they have a person, an adult, not necessarily a parent, but an adult that they can talk and trust and communicate with? Are they connected within their community? Are they, are they spiritual? Or are they connected with their church? So there's, those protective factors that kind of can decrease some of those risks. And so with the pandemic, it's had such a huge impact on just the way that we live. It's really impacted people's those protective factors, because we're not able to go out and do the things that we've normally done to take care of ourselves, to feel like we belong within our community, to connect with other people. So that's a part of why the pandemic has had such a huge impact, and it's just causing more mental distress.
It seems as though the solution to the pandemic also created other forces that started creating potential harm as well, which is one you just pointed out, the sense of isolationism, and the church thing. Church is a big deal for folks, and that's a big thing. And in fact, there are folks that are out there listening that probably would say to you, yeah, that's the most important time of my week, my time in connecting with my church family. And now, during the pandemic, we've been told not to do that. Has that increased this, not only anxiety, but the fear and so forth that would drive people down that road of suicide?
Absolutely. And so as human beings, we are designed to connect with other people. We're not designed to isolate. And it truly goes against just what comes natural for us. And in this pandemic, we have had to isolate to protect ourselves, minimize that risk. And at the same time, it's really it caused more mental distress, because people now have less people in their life that they're communicating with, that they're connected to. They're not feeling like they belong to their community. And so, that isolation is huge, has made, definitely contributed to just more mental distress for everyone. And especially your elderly individuals, that's already just an area that is already a struggle pre-pandemic, is just that isolation. And so now that is even more a problem as people are, staying at home more, afraid to go out and meet, see family members, older family members, don't want to put them at risk of getting COVID, and vice versa, as well as our children and teenagers. Developmentally, teenagers are at the age where the most important thing for them is to socialize and to be social. That's where they're at developmentally. That's what comes naturally to them. And with the pandemic and the orders for us to remain at home, truly just goes against what they're supposed to be doing, during that age. And it's been really, really difficult for them to adjust and adapt to that, because that's how they learn, that's how they grow, that's how they just develop.
Well, we've covered quite a bit of stuff today, and a lot of information, and clearly a lot of things that I know we wanted to get to and we're not able to get to simply because of the time. I want to thank you for being with us. Certainly we'll post you on the internet with the telephone number to contact you. And again, it's one of those things that some of the questions we can answer. Some of them are very individualized and simply can't be answered. But thank you for being with us.
Oh, you're welcome. Thank you so much. We'll be able to provide a list of just resources.
Okay, thank you. Well, ladies and gentlemen, I want to thank you for being with us today. We look forward to seeing you again next week, and may God bless.
Thank you for tuning in to this week's episode of We Should Know with host J.W. Simmons. If you have a question, comment, or suggestion regarding this or any episode, please send your emails to weshouldknowedu@gmail.com. And remember to tune in every Tuesday at 2:30 for another informative episode of We Should Know.